Rand. Okay, thank you, Sophie, and thanks, Eddie and Alistair. That was some really great information. I'm quite new to the world of being in technology, and as such, so maybe this will be a bit briefer, but it's just been my experience through COVID. So during the time, I basically have gone from having this really social life. I used to play football. I'm a practicing dentist, which got affected quite a lot. I used to go out for meals. I had time with my family, and all of a sudden, COVID came along and it disrupted everything. So, a bit about my background. So, I'm a dentist by degree. And one thing that I noticed a lot with interacting with patients and common diseases, so dental decay, caries, it's so preventable. It's very avoidable if people just brush their teeth. So that mentality's always been there with healthcare. So for a little while now, actually, I've been thinking about the idea of trying to get into healthcare and trying to affect big problems. So me and my partner, Divya, we founded our own company, and our goal was to transform healthcare through technology and driving prevention rather than treatment. Now, it's difficult when there is a lot of hurdles. One of the things that we're always facing is the sort of bureaucracy of trying to treat a problem. So COVID-19 came along and we thought, well, what's the issue here? There's a global virus, and at the time there was no vaccine. There was limited resources. We're hearing about ventilator shortages, GPs being overstretched, even nurses overworked. So prevention was going to be the key to this, and at least at the early stages. So how did we react? Well, actually, it happened over a FaceTime call with my dad. We were sitting there having a cup of tea when we should have been sitting together, and we were discussing actually what would be so useful is keeping distant. So what happened with this was we talked about different ways that you could try and keep distant. Yes, you see stickers on the floor saying keep your distance, but sometimes you ignore them. What's the one thing you're always checking? It's your mobile phone. I'm a bit guilty for it. Sometimes I'll be walking with my head down on my mobile phone. So why can a smartphone that can do almost everything that from MP3 player, take photos, why can't we use this to try and help solve the problem? Maybe not completely eradicate it, but at least start being what we call a nudge. So we drew out a little concept. We just drew on a piece of paper and we made an MVP. And when I said MVP, this literally was a phone with a load of distances of different devices, and really couldn't use it for anything. But what it did show is we could start to use a mobile phone to find distances of other devices. And if everyone has a mobile phone, or assuming a lot of people have a mobile phone, we at least can use that to start creating a product that could help them. So we applied to Innovate UK, and they liked what we were sort of pitching, and that spurred us on to build Spacer. Now, Spacer is a mobile application. It's going to be completely free, and we're kind of in our final stages now. I'm just going to show you a little video of how it works. So basically, it helps you range other people. So these little heads and figures are completely anonymous. You wouldn't know who they are, but it shows you if they're close, closer. We don't want to give you an exact range because that can start to breach privacy. But imagine this, imagine you're trying to go out to the shops and you forget your mask. Well, you don't want to get to Tesco's and all of a sudden realize, oh, I've forgotten it. So we added this alert. You leave home, your Wi-Fi says you're gone, you've got your mask, you get a little reminder. You get back home, you want to protect everyone in the house. Well, actually, we're going to tell you to go and wash your hands now, and because you're always on your phone potentially, you'll actually react to this reminder. And finally, we also put a proximity alert in. Now, all of these things were basically to help do what we call a nudge. In healthcare, one of the most important things is to encourage patients to pick up healthy practices. There's no point saying somebody who's potentially reaching an overweight stage, you need to exercise more, you need to do this more, just forcing them. But what they found was if you gave a few patients a pedometer, a step counter, they actually want to live up to the step counter. They actually want to react and start to see an improvement. So we went on this principle, and we found we just personally used it to begin with, and we found we were actually keeping distance, remembering our mask. Oh my God, remembering our mask was probably the best thing. The number of times we left, and we live on the 10th floor in like a tower block. It was such a pain getting out to Tesco's or to Co-op and realizing we didn't have a mask with us, and you don't want to go in and endanger anyone. So we're running back. but now that's less of an issue. So yeah, what was the real innovation here, I think would be the question. Well, the real innovation was, what do we need? Well, we need a way of remembering to keep this and keep safe, and keep sort of making sure we're protecting everyone. And what do we have? Well, we have smartphones, but they weren't being very smart at the time. So it was bridging that gap that was our innovation. So now we're at the point where Space is at the point it's under review by Apple. They obviously don't want to let just any app onto the App Store, so we're working with them quite closely to work out what we want to sort of deliver as a very private app. We don't want to give away any personal data. We don't have to sign up to it, because this is one of the hindrances to certain other apps being used by the government. I want to kind of pass that. We also then want to think, how can we now use this technology? Innovation is not something you just do, it's an iterative process. So we think, well, we have this technology, it can help prevent disease and prevent its transmission locally. So we want to start exploring how we're going to apply it into broader settings which see a lot more infection transmission. And that's where we're going to start looking into secondary healthcare, so hospitals and as such. That's a very short pitch, and I'm happy to take any questions now, but I'll hand it back over to Sophie.